The opioid crisis has affected every corner of the country, and organizations here and beyond are trying to save lives by handing out Narcan by the thousands.
But is that helping or is it hurting? January Keaton has more.
We're up to like 3,000 kits that we've distributed.
It helps because they're not people. We don't plan to die. Period. You know what I mean? It happens.
We're bringing back, people's daughters, their sons, moms, dads. It's life-saving.
Today, I took a ride with Dean Roff of local advocacy group Homeless Hookup while he distributed Narcan to Cleveland's homeless and addicted.
That's the life-saving tool that we have on board.
Ryan, a homeless heroin addict, has used Narcan over 100 times on friends and says he's had it used 49 times on himself.
But everybody should have it in their home, even if they don't have people who use heroin in their home. They should have it.
Narcan, or naloxone, is a fast-acting medication that treats respiratory failure.
You're looking at somebody who's like dead. I mean, they're blue, their lips are blue, they're pale as like their shades, they're gray, like a grayish blue, and it's scary.
What do you do?
You put Narcan up their nose, you rub their sternum really hard, and most of the time they come right back.
According to the CDC, opioid-involved overdose deaths rose from just over 20,000 in 2010 to over 68,000 in 2020.
All of our overdose deaths, the majority are related to fentanyl, and that's about 500 deaths a year.
Roughly 80% of heroin in our state is laced with fentanyl. Critics say easy access to Narcan makes addicts less cautious because it can instantly save lives. But Roff, who hands out hundreds of these little packs a month, says Narcan also changes lives.
I have a family member that wouldn't be here today if they didn't have it. They used it on her more than once. She needed more than once. And do you know where she is today? She's married with a family and a nice house. She's sober? Sober for years.
Now, a survey by the U.S. Substance Abuse and Mental Health Services Administration found no correlation between Narcan access and more risky or increased drug use. But Cuyahoga County Medical Examiner Dr. Thomas Gilson, who you saw there in the piece, has issued a public health alert after just the first half of July saw over 30 overdose deaths, Laura.
One is too many.
Absolutely,
All right.
Yes.
Yeah, January, thank you so much.